So we are going to learn about the basic anatomy for the dialysis vascular access. This presentation will give us some idea that how arteries are formed and the veins are formed. So these are the central veins. Central vein means that those veins which are in the rib cage, arch of aorta, and on the right side there will be the brachiocephalic trunk, which is divided into the common carotid artery and the subclavian artery. Subclavian artery is continuing as a axillary artery. On the left side there is a direct formation of the left common carotid artery and the formation of the brachiocephalic artery, which is continuing as a subclavian artery that continues further down as a. This is the proximal portion of the subclavian vein. This is the internal jugular vein. This is the common carotid artery. So common carotid artery is joined by the subclavian artery, and this is the part of the proximal portion of the subclavian vein. So this portion we can see above the clavicle, and this portion we can see below the clavicle. Now it continues below the clavicle as an axillary artery, the axillary artery, and it's followed by the axillary vein also, which is further down and is continued as a brachial artery. So this is the axillary artery. From the lower part of the teres major, there's a brachial artery is going to divide into the radial artery and the ulnar artery, which further goes down and forms the ulnar artery and the radial artery. The radial artery and the ulnar artery breaks down into two and forms the superficial palmar arch and the deep palmar arch. There are two branches of the ulnar artery, deeper branch and the superficial branch, and the two branches of the radial artery, superficial branch and the deeper branch, which forms the deeper palmar arch and the superficial palmar arch. So the formation of the digital veins form the dorsal veins, which connect and form the basalic vein of the forearm and the cephalic vein of the forearm. This is a basalic vein, this is a cephalic vein, and the median vein. This forms the median cubital vein. Sometimes it joins the basalic vein and or the cephalic vein. Of the arm, it continues on the anterior aspect of the arm and then goes into the deltopectoral groove. In the deltoid pectoral groove, it runs and then passes the fascia in the clavipectoral fascia on the lateral border of the. Here, the basalic vein of the forearm joins the median cubital vein, forms the basalic vein of the arm, and which is joined by the deeper veins, brachial veins, and forms the axillary. Then the basalic vein is joined by the brachial veins, forms the axillary vein, which is joined by the cephalic vein, and which forms the arch known as cephalic arch, and it continues as a distal part of the subclavian vein. So this is the distal part of the subclavian vein, then the proximal part of the subclavian vein, and the subclavian, this is axillary artery, joined by the cephalic arch, cephalic vein forms the subclavian vein, and which is joined by the internal jugular vein, forms the brachiocephalic vein. This is the brachiocephalic vein, which is joined by the left brachiocephalic vein, forms the superior vena cava. Hi everyone, I am Dr. Aadil Beigh. I am an intervention nephrologist working in the Apollo Hospital, New Delhi. So today we are going to learn the pre-assessment for as we know that the fistula starts from the heart and ends at the heart. So I have selected the probe. It's a cardiac probe. Its frequency is 1 megahertz. So 1 to 5 megahertz. So I will do the echo first. So this is my subject. I want to see the parasternal, showing you to the parasternal long axis view. My probe is in the third and the fourth intercostal space. So as you see, this is the left atrium, this is the left ventricle. The systolic function is very good. This is the interventricular septum. This is the mitral valve. The contraction is very good. So this looks the normal heart with the normal ejection pressure. Now this is the apical view. I can see the 4 chambers. This is the right ventricle, this is the interventricular septum, this is the left ventricle. There is a very good motion of the left ventricle. Mitral valves are opening nicely. This is a left and the right atrium. Selected the linear probe. Its frequency is 6 to 13 megahertz. Is a linear probe used for the superficial structures. So we'll see the vessels by. So my probe is on the neck, side of the neck. I can see the carotid artery pulsating. There's a internal jugular vein, and I can see this tissue. This is the isthmus of the thyroid gland, and these are the cartilage of the trachea. So if when I go down, I can follow the internal the carotid artery. So see the carotid artery. So carotid artery, now it will join here, it will join the subclavian artery and form the brachiocephalic artery. So if I want to see the brachiocephalic artery, I'll make more depth, and this is the subclavian artery. This is the junction of the subclavian artery with the internal carotid artery, common carotid artery, and this is the brachiocephalic artery, and this will be the arch of the aorta. So this is the arch of aorta, brachiocephalic artery, and joining of brachiocephalic, this joining of the splitting of the brachiocephalic artery into the subclavian artery and the internal carotid artery, this common carotid artery. So this is the common, saw the proximal part of the subclavian artery. Now I have put my probe below the clavicle to see the distal part of the subclavian artery. So this is the subclavian artery, this is the subclavian vein, distal part. So I will do the Doppler of this and see the peak systolic velocity. Of the patient. So first I will do the transverse section to look for the arteries. So this is the axillary vein, this is the axillary artery. So I will turn my probe and will try to see the artery. This is the axillary artery with a branch. So now I will take the Doppler to see the flow. I have put my probe in below the axilla to see the brachial artery, the formation of the brachial artery. So this is the formation of the brachial artery. This is the basilic vein, and this is the brachial artery. So if I press, there is a pulsation in the brachial artery. So I will put my probe in the transverse, then the longitudinal position, and see the flow in the brachial artery. So this is the brachial artery. So there is a good pulse style flow in the brachial artery. The peak systolic velocity is around. We'll see the brachial artery. This is the brachial artery. We'll same way take the flows. There is a triphasic flow with a peak systolic velocity of around 50. So then we'll take a caliber and see now the walls. We can see if there is a calcification, there is a compressibility, and what is the diameter. So we'll take the diameter. So the diameter of the brachial artery is 3.4 mm with a good triphasic flow with the nice walls. So we can take also the medial intimal thickness like this. We'll see this is the medial intimal thickness of around 0.9 mm. Move down to see the bifurcation of the artery. So the brachial artery, it breaks into two, the radial artery and the ulnar artery. So now I will show you, this is the brachial artery. So we are expecting it to break into the two. So this artery is breaking into two, 1 and 2. So I will try to look this region in the longitudinal view. So this is the brachial artery. So brachial artery is breaking into the two, the deep one, going to the radial, this is the ulnar, and this is the site. As you can see, this is the brachial artery. It goes like this, or I can see like this. So this one is the radial artery, and this one is the ulnar. So good caliber, looks good. So this, I have reached the wrist. So I can see it in the longitudinal wave also. So I'll take the color Doppler to see the flow and the peak systolic velocity of the radial artery at the wrist. This is the intima. So we have to take the intimal diameter. So this is around 2.1 mm artery. We'll move down to see the continuation of the radial artery, that is the arch, palmar arch. So this is the radial artery is going down. This is the radial artery going down and making the two arteries, breaking into the two arteries, 1 and 2. So one will form the superficial palmar arch and one will form the deeper palmar arch. So this will go down, one deeper and the superficial. This is the longitudinal section of the deep palmar arch. Now I will take nice triphasic flow in the palmar arch. Deep palmar arch is patent, and the flow in the diastole, flow in the systole. So we have seen the palmar arch, deep palmar arch. Now we can see the distal arteries also. I will show you how to see the distal arteries. So we can see along the side. So there are the digital arteries. These are the distal arteries, proper digital arteries. You can see the pollicis digital artery also, the digital artery of the thumb, distal artery of the index finger, and the digital artery of the other fingers. So with that, we have completed the arterial system from heart to the fingers. Now we'll see the venous system. So I am at the wrist in the snuff box. So we can see in the snuff box, we can see the radial artery, and along the radial artery there is a vein. This is the vein. This is the formation of the cephalic vein of the wrist. So I can take I will freeze it with the least pressure. I will try to take the nice circle vein. So we'll see the diameter of the vein. So this is 2.8 mm vein diameter, and we'll follow it. So this is the above the wrist. So at the site of the formation of the fistula, cephalic vein with the radial artery will see the distance between the two. So this is the radial artery, these are the vena comitans, and this is the cephalic vein. We'll freeze it, we'll take a better picture, and we'll take the so the distance between from the artery and the vein is around 7.3 mm, very close to artery. So we'll follow the vein, cephalic vein, joining the median cubital veins. Now this is the median cubital veins, this is the medial cubital vein, joining it and making and forming the, and is breaking into the two, and this is the cephalic vein of the arm, and this is another branch, and this is continuing as a basalic vein of the arm. You can see now this is a median cubital vein. First this vein, this cephalic vein is joining to the median cubital vein and then again dividing, forming the cephalic vein of arm and the basalic vein with the least pressure on it, and will measure the diameter of the vein. So this is very good vein, around 4.3 mm in diameter, and it's around 1.2 centimeters away from the brachial artery. With this preliminary knowledge, we can make a fistula with a good outcome at the radiocephalic fistula, with the close proximity of the vein to the artery, and with the long segment of the cephalic vein, which is joined by the vein, and the cephalic vein ends ultimately joining the axillary vein and forming the arch, which is known as cephalic arch. In ultrasound assessment, when particularly you are going to make the fistula, upper limb fistula, brachiocephalic fistula, so you have to see the status of the cephalic arch. So this is the cephalic vein. So this cephalic vein is now running into the deltopectoral groove. This is the vein. You can see this is the vein in the deltopectoral clavipectoral fascia. I can see the vein. I'll make it more deep so that I can see the axillary vein also. So this is the cephalic vein. This is the cephalic vein. This is in the deltoid, below the deltoid, and this is the deltoid muscle, end of the deltoid muscle. This is the pectoral muscle. So it goes, this is the fascia. So it will purse the, so this is pursing, it will purse the fascia, deltopectoral fascia at the lateral part of the clavicle, and goes deep and joins the axillary vein. So this is the cephalic arch, this, and joining the axillary vein. So I will try to get it in the longitudinal way. this is the cephalic vein passing the clavipectoral fascia and smoothly joins the axillary vein. So this is the axillary vein, this is the end of the axillary artery. So this is the cephalic arch. You have to see the cephalic arch when you are going for the formation of the fistula. So the status of the cephalic arch is very important, because the commonest site of stenosis in the brachiocephalic fistula is cephalic arch stenosis. Why? Because it's a curved portion. This it's a straight one, but there it's some curve is there. So this is a curved portion. So there's a valves in it. So there are a lot of valves, in 2 to 3 valves in this portion, and whole of the cephalic vein from the elbow to deltopectoral fascia, it contains 2 to 3 valves, but this portion is full of valves. It contains short segment, contains 3-4 valves. One, second, it's a curved portion. Third, and there's an angulation when it joins the axillary artery. These things make it more prone for the stenosis. So you have to see. So from wrist we have reached to the elbow. We have seen the median cubital veins joining the cephalic and the basalic vein of the forearm, then forming the basalic vein of the arm and the cephalic vein of the arm. So the basalic vein of the arm, now I come to the basalic vein of the arm. This is the basalic vein of the arm. This is the brachial artery. So the basalic vein of the arm, it will be joined by the deep veins, that is the brachial veins. So the vena comitans of the brachial artery will join the basalic vein and form the axillary vein. We'll see where. They are joining. See, these are the vena comitans. So now they will join the basalic vein. See, it's joining. This one also joined and forming the axillary vein. So they have joined. This is a big caliber. This is the site of joining of the vena comitans with the basalic vein. So when we form the basalic fistula, basalic brachiobasalic fistula, we should know how many branches are there at least. So there are not much branches. This is one. We have to tie it. There's one more. See, this is the branch at the site of the elbow. This, no, one. So this will act as a accessory vein later. So, and now there's a formation of the axillary vein. So it will now vein in the axilla. This one. So this is the axillary artery. So now we have seen the axillary artery. We'll see the distal part of the axillary vein. Try to see the distal part of the axillary vein. So sorry, the distal part of the subclavian vein. So this is the valve in the vein, subclavian vein. This is the distal part of the subclavian vein. I can see it below the axilla, below the clavicle. Now this is the proximal, this is the distal portion of the, this is the distal portion of the, with the, you can see the cephalic arch and the formation of the subclavian vein. So this you can make out that there is a cephalic arch forming the subclavian vein with a big valve in it. So this is the proximal portion of the, this is the distal portion of the subclavian vein. So I am looking below the clavicle. Now I'll see above the clavicle. Just like we have seen the arteries, we'll see now the veins. So I'll follow, this time I will follow the internal jugular vein. So I'm following the internal jugular vein. This will join the proximal portion of the subclavian vein. So now see, this is the subclavian vein and this is the axillary vein, and they will form the brachiocephalic vein. So this is the brachiocephalic vein. This is the brachiocephalic vein, and it will join by the brachiocephalic vein of the left side also. So you can see this is the brachiocephalic vein of the left side joining it and will form the superior vena cava. So there is a patent good caliber internal jugular vein which is joining just now like this. Now the subclavian vein joined by the proximal portion of subclavian and continuing as a brachiocephalic vein on the right side, which is joined by the opposite brachiocephalic vein, the left side. So this is the left brachiocephalic vein, and this is, if you can see clearly, now you can see this is the brachiocephalic vein on the left side, and this on the right side, this is the subclavian, this is the internal jugular, and forming the, we can see the upper part of the superior vena cava. So we can take the patency by doing the Doppler of these vessels. So there's a respiratory variation. We'll ask the patient, subject, to take a deep breath. सांस लो लंबा. So there's a chodo. So there's a respiratory variation, you can see. So that means the superior vena cava is patent. To see the central veins more clearly, so I want to see the right brachiocephalic vein joining the left brachiocephalic vein and forming the superior vena cava and the portion of the right atrium also. It's very important to see these veins because these are deeper veins, and we have to do the either the CT scan for the venous system, CECT, or we have to do the fistulography or the venography of the central veins. So I used to do this thing, that I take the abdominal probe, curvilinear probe, and try to look for the central veins. So I will follow, this is my internal jugular vein. So I will put my probe on the neck, try to look for the internal jugular vein. This is the internal jugular vein. Try to follow it till I felt the resistance of the sternum and the clavicle. So, and I will tilt the probe. I am looking at the internal jugular vein which is joined, see, this is the subclavian vein which is joined, this is the artery which is joined by the subclavian vein forming the brachiocephalic vein. So this is the right brachiocephalic vein. Now you can look here, you can see clearly now that the opposite brachiocephalic vein means the left brachiocephalic vein forming the angle here. So this is the right brachiocephalic vein, this is the left brachiocephalic vein forming the superior vena cava. So if you make more depth, so you can see the cardiac activity also. This is the so this is the right atrium, this is the superior vena cava, this is the left brachiocephalic vein, this is the right brachiocephalic vein. We can see the respiratory variations in all these veins. Take a breath, take a breath. लंबा सांस लो. छोड़ो. The central veins. And now this session is over. If now we'll go for the question answer session. If you have a query, then ask me. Thank you.